Autism, a general term for a group of brain disorders. Autism disorders are characterized by several degrees: difficulties in social interactions, verbal and nonverbal communication, and repetitive behavior. Treatment and therapy for autism is usually a very intensive, comprehensive undertaking that requires the child's whole family and a team of professionals. There are specific treatments for autism like applied behavioral analysis and developmental approaches. ABA, or Applied Behavioral Analysis, is the application of the principles of learning and motivation from behavioral analysis, and the procedures and technology derived from those principles. Discrete child training, pivotal response training, verbal behavior intervention, early intense behavioral intervention are all different approaches or types of applied behavioral analysis. Discrete child training is a method of teaching in simplified and structured steps. Instead of teaching an entire skill in one go, the skill is broken down and built up. Using discrete child training that teaches each step one at a time, pivotal response training is a naturalistic intervention model derived from ABA approaches rather than target individual behaviors one at a time. PRT targets pivotal areas of a child's development, such as motivation, responsivity to multiple cues, self-management, and social initiations. Verbal interventions will focus on getting a child to realize that language will get him what he wants when he wants it. Requesting is one of the first verbal skills taught. Early intensive behavioral interventions are a treatment based on the principles of ABA derived from multiple years at an intensity of 20 to 40 hours per week. Developmental approaches such as floor time, teach, and early start never model are some more specific treatments. Floor time, or DIR. The objectives of DIR is to build the healthy foundation for social, emotional, and intellectual capacities, rather than focusing on skills and isolated behaviors. Training and education of autistic and related communication handicapped children, or TEACH, is a service, training, and research program for individuals of all ages and skill levels. With autism spectrum disorder, Early Start Denver model is a play-based intervention that focuses behavioral and developmental principles into an integrated approach. A person living with autism spectrum disorder needs different services and treatments like speech therapy, occupational therapy, physical therapy, and sensory integration, social skills training, and picture exchange communication. People with autism spectrum disorder also have dietary, medical, and other alternative interventions. Many parents of children with autism spectrum disorder try a gluten, casein-free diet. Gluten is found in wheat, barley, and rye. Casein is found in dairy products. The parents who try these gluten, casein-free diets notice an improvement of the behavior of their kids. They may also try a non-GMO diet to help too. There are also several reasons that kids on the autism spectrum may need vitamins or supplements to help out their diet, such as chronic diarrhea or constipation, some inflammations in their stomach, and a tendency to restrict their foods. So vitamins and supplements are sometimes needed, such as melatonin, omega-3, multivitamins, vitamin B12, and vitamins B12. Medical interventions for related symptoms such as ADHD, depression, and seizures are also needed. Alternative treatments are melatonin and deep pressure.